Hello, everybody, and welcome to the Ideas Hive. My name is Kristen Anderson. I am the Chief Branch Officer of Ideas for Us. And tonight we're going to have a great conversation about local food systems from Glen Providence, from the local nonprofit Hebni Nutrition. And I'm super excited to have this conversation. As you all know, or should know, flea farming is part of our operations as Ideas for Us. And so local food systems is super important to us. It's going to be a great conversation about how we've been incorporating this into our community. So if you aren't familiar with Ideas for Us, we are a local environmental nonprofit, and we work to develop, fund, and scale solutions that solve the world's most pressing environmental and social challenges. And the way we do this is we use a model that we replicate in our branches around the world. We educate, engage, and mobilize the community in environmental action. So every month we host the Hive meeting and different workshops to give the community the information that they need in order to solve these global environmental issues. So this takes the form of bringing in experts to kind of educate the people on different topics that align with the United Nations 17 Sustainable Development Goals. And then we use those goals and ideas that we come up with in these meetings to implement local solutions to the global environmental challenges. So we work with an amazing team of volunteers to plan and organize different events, and then we implement those and bring those ideas to life through our monthly eco action projects, which we usually have 4 or 5 or more eco action projects a month. And we have a lot coming up all throughout the summer, especially this month, and I'll talk about all of those opportunities to get involved at the end. And every month we focus on a different pillar of sustainability, cycling through the 5 pillars of energy, water, food, waste, and ecology. We identify these as the pillars because everything in environmental challenges can fall under one or more of these pillars of sustainability. So every month we want to focus on something a little bit different so that we're able to take a multifaceted approach to the climate solutions. And we do this because we believe that this information should be available to the community, and you all should know what challenges we are facing, but not just stopping there, also having opportunities to take action against these environmental challenges. And we do this in our branches around the world, as well as domestically. And if you're interested in supporting this mission and seeing more of this eco action, please consider donating. You can donate on our website or on Facebook. We have a Facebook fundraiser right now going on for our branch in Nepal as they're doing a COVID relief program that I'm going to talk about a little bit more at the end. So if you're able to, please consider donating. And you can also listen to these kinds of conversations all month long through our awesome podcast with different leaders of sustainability talking about their innovative ways that they are taking climate change into their own hands. And so today I'm super excited to have the amazing Glen Providence here with me. He is the Executive Director of Hebni Nutrition Consultants Incorporated. I'm so excited to hear from him and everything that they're doing in the community. So thank you so much, Glen, for being here. You can go ahead and unmute and share your screen.
Okay, good evening, everybody. Hope everyone can hear me okay. It is a pleasure and a privilege to be here. And Kristen, thank you for the introduction. That, I think, is the first time I've ever been called amazing, so I appreciate that. And so I just want to say how proud I am of the work that you guys are doing, and I am glad to share the little bit that I will tonight about Hebni and look at connecting with members in the audience, the viewing audience, and finding different ways to connect. So again, my name is Glen Providence, and I am the Executive Director of Hebni Nutrition. I've been with Hebni for almost 13 years now, 12 and a half years. Kind of stumbled on this work, but I'll tell you, it is some of the most meaningful work that I've ever done, and I'm very pleased to share some more information about Hebni with you. So we are a 25-year-old nonprofit organization. We were founded in 1995 by registered dietitians. And we work to improve the community that we live, work, and serve in through comprehensive nutrition education. Our mission that we have carved out, and we kind of worked over the last couple years to tweak this, but it's to provide culturally appropriate nutrition education and intervention strategies to prevent diet-related diseases. So everything that we do is surrounded around that mission. What COVID over the last year has done is really bring to the forefront the issues surrounding food access, food insecurity, and their relationship to food and diet, and how the work that we're doing now from an organization that's 25 years old is more needed today than it was when we first launched 25 years ago. We are located in the zip code 32805, one of the poorest zip codes in Central Florida. Right smack dab in the middle of a food desert, and I'll touch on that a little bit later. Our facility is made up of, first and foremost, a state-of-the-art teaching kitchen where all the quote-unquote magic happens. There we do nutrition education classes, on-hand cooking demonstration, nutrition counseling. We promote entrepreneurship through some different programs that we do. But first and foremost, our ultimate goal is to meet the needs of the community that really the role of a dietitian is often left out of the continuum of care unless you're in a hospital setting. So being the community nutrition practice that we are, what we often do is really, number one, provide a service to people who couldn't afford the services of a dietitian. And secondly, we find that people are, no pun intended, hungry for this information, but are often left to navigate the care continuum on their own. And so we're fortunate in many instances and look to connect with individuals who are looking to make a lifestyle change and not sure where to begin, or started a lifestyle change and struggling with it and need some guidance. And we're glad to come alongside of them and help them in the different ways that we do. So I'm going to go through a little bit of how we do that through the different programs and services that we offer. Our Project Oasis course, our Healthy Souls, our Fresh Stop Mobile Farmers Market, our Kids Take Charge program, and nutrition education materials that we've developed over the years. And you're going to start with our Fresh Stop bus. Our Fresh Stop Mobile Farmers Market is our largest program that we operate. We launched Fresh Stop officially in January of 2015. What you're looking at on your screen are some highlights and some pictures of our grand opening event that we held in December 2014. And that was an incredible day to take a concept from an idea to an inception to execution. So we're really proud of that. And we have since grown Fresh Stop to 3 vehicles. So Fresh Stop is that top middle picture. It's a 40-foot retired Lynx bus. And then that bottom left picture is kind of what it looks like on the inside, cantilevered shelves. And we sell nothing but fresh produce on the bus. We go out to food desert neighborhoods where there is no major grocery stores or places where people congregate, and make it easier and more accessible for people to have access to fresh produce. So a lot of senior centers, a lot of lower income neighborhoods. And in addition to the fresh produce, we'd be remiss being a nutrition organization if we did not come alongside and provide recipes, on-site cooking demonstrations, and really use the bus as a recruitment tool to get people back into our Nutrition Resource Center to provide them with opportunities to take classes and the classes that we offer and the information that we provide, we go after grants. And so none of these classes are at a cost to the participants. Because again, we know with our target demographic that if the participants had to pay for it, they wouldn't pay. Our core demographic is often people who couldn't afford the services of a dietitian. Since our launch, we've grown a little bit. On the top right, the orange van is Fresh Stop Junior, and that's the orange van. And then on the left, the green van is Trey, Fresh Stop the third, and it allows us to be in multiple places at once, all with the core mission of providing access to fresh produce in underserved neighborhoods. And just a little bit about the Fresh Stop model. As you can see, Fresh Stop is kind of in the core, in the center of how it works, and then how it spokes out, starting at the top right, going out to community events. We're often requested to be at health fairs and different wellness events, and we're happy to be a part of that to help spread information and wellness messaging, and of course, nutrition education to throughout the community. Our Project Oasis class, I'll talk about that. Again, the bus serves as a recruitment tool. So I'll get into Project Oasis in a little bit. We also have a corporate wellness initiative, and the bus that falls under the Fresh Stop umbrella. But we work with small to medium-sized companies and work with their employees to bring more employee wellness. And then schools, we have a robust childhood obesity program, which I'll also talk about a little bit later. But it is a hoot when we take the bus out to the schools and watching the kids interact with the bus and the different things that we do to really work with them. And just a little bit of numbers. This is for the period March 2019 to March 2020. We measure our customer satisfaction rate at the various stops that we go to. So we're really proud of that 96% satisfaction rate. That 22,000 number is actually the number of sponsored and non-sponsored stops that we've gone to. So a total of outside Central Florida, numbers totals over 22,000. In sales, our average ticket is $5.23, and we have a partnership with Orange County Public Schools, and during that period, we distributed over 1,500 pounds of produce to kids. Our next program is our flagship nutrition education program called Project Oasis. And I know the screen is real busy and I won't go through the whole thing, but it's an 8-week, I like to call it Nutrition 101 program that really reaches people on the different levels that they may be at when it comes to lifestyle, and trying to make an effort to increase or improve their overall health. It's an 8-week class. We do pre and post labs on our participants in an effort to measure the efficacy of the programs. So we do height, weight, BMI, cholesterol, and of course, A1C. One thing that's very important about this class is that A1C measurement is the measurement of diabetes, of your blood sugar level over the last 3 months. And it is not uncommon when we operate Project Oasis that we capture and diagnose people who are diabetic and had no idea that they were diabetic. And that is key because diabetes is a silent killer. And we want them to become aware of their numbers, and begin becoming better self-managers of their overall health. And so knowing your numbers is the first step of that. And as a part of Project Oasis, participants get fresh produce from Fresh Stop. We do pre and post labs on them. They participate in cooking demonstrations and lessons with the dietitians. There's monthly support groups. We do pre and post surveys on knowledge and behavior. And there's also an exercise component to Project Oasis. And we've been running Project Oasis for 10 years, and we do it 4 times a year. As a matter of fact, we're getting ready to start up our next round. I don't know the exact date, but sometime in mid-July is our summer session that we begin. And last but not least, we, about 2 years ago, actually 3 years ago, introduced, and way before COVID struck, a telehealth platform. We partnered with an organization called Healthy. And so we can operate the program in a virtual manner. So when the COVID shutdowns and restrictions started falling into place, we were able to pivot online fairly quickly because we had already had a platform in place from which to facilitate that. These are just some pictures these are all pre-COVID pictures, I want to state. So just some of the sessions that we've had with participants cooking. We get them in the kitchen. We kind of have this slogan: you burn it, you eat it, because we want them to become familiar and learn about trying to dispel the myth that eating healthy is expensive. We teach them, we try to dispel that myth. Eating healthy can be expensive, but we can, through our classes, we want to emphasize that with meal planning and portion control and just getting back in the kitchen and shopping, effective shopping, things that, and the tips and the tricks that they can take to eat healthier. And I won't go through these numbers in detail, but you can just see some of the bullet points of some of the highlights of the program. Half the participants reduced their BMI. Even if that's 1 point, we view that as a win. And participants with elevated A1Cs. So just for the sake of this discussion, anyone with a A1C higher than 6.0 was actually considered diabetic. So to get a reduction in that range is great. So that is a little bit more about Project Oasis. And so that's our Nutrition 101 class. We also have a focus on childhood obesity. And really, this is nothing but trying to start earlier. We know that childhood obesity is a chronic problem that's related to lack of exercise, poor food choices. And so we work with kids. These are classes that are led by dietitians. And especially what we found in low-income neighborhoods is that there's a lot of latchkey kids that are going home and in many cases tend to fend for themselves. They may have a quarter, 50 cents and going to a corner store and buying a bag of chips or what have you. And so through our kids program, which as you see up above is an acronym for Keep Your Diet Straight, we work to introduce healthy lifestyles and expose them to age-appropriate meals that they can prepare. We do the program in a couple of different ways: directly at schools, generally Title I schools, where the majority of kids are free and reduced lunch, and then at our Nutrition Resource Center. And we also do pre and post knowledge and behavior survey on the kids. And we do everything from water consumption to screen viewership to grocery shopping, because although some parents hate it, we do want the kids to go grocery shopping with their parents. They can learn more about the shopping experience, because again, just through anecdotal and just our research that we've done, many people may have in school, you may have learned how to balance a checkbook or even change a tire or what have you, but in schools there's really not options for home economics anymore. So learning how to cook, how to shop is really something that's not really being taught. So we feel that this is important to introduce to kids, and we're always happy to work with them. We're actually getting ready in 2 weeks. I think it's June 14th, launch our very first kids cooking camp, where we'll have kids coming in to participate in a week-long kids summer camp at our Nutrition Resource Center. So we're really excited about that. And then kind of going from one end of the spectrum to the next, Healthy Souls is our exercise class led by an exercise professional, and it's low impact, but again, we want to care for our seniors, and being in Florida where there's a larger concentration of seniors, we are really proud of this program and its impact. This next slide talks about educational materials that we've developed. Two of our founders, Ronice Weaver and Fabiola Gaines, have written six cookbooks for the American Diabetes Association, all about healthy soul food, putting a facelift on Southern food or soul food, and especially with people with diabetes in mind. And so those are some of the books that you've seen on the bottom. And then we've also developed nutrition education tools. That the Soul Food Pyramid is kind of what got Hebni on the map. That has been around for over 20 years. And then when the switch happened to My Plate, we developed the Soul Food Plate, which serves as a tool to show people how, because you don't eat from a pyramid, you eat from a plate. So we go through and use that as a tool, as a guide to show people how to build their plate and to make, understand portion control and nutrition fact label reading, and all that information is included in that information tool. And then we had the incredible opportunity to work with a partner organization called MHP Salud, where we were able to convert the Soul Food Plate into Spanish, into 2 different versions in Spanish. And we're actually now working with another organization based out of California, where we are translating the plate into various languages for the Asian community. So we're extremely proud of that work. And that is, in a nutshell, a little bit about Hebni. And I felt like I kind of breezed through that, but wanted to make sure I had some time for questions and answers. You're on mute, Kristen.
Thank you. Awesome. Well, thank you so much for that. It is so incredible to see you guys doing this essential work of just, helping people take care of themselves, because that is so, so important. And way too many people just do not know how to do that. So first of all, congratulations, and thank you so much for all you're doing. I want to open it up to questions from the audience. So if anybody has any questions, please go ahead and put them in the comments. I already have a question from the comments. So we have a question that says, where does your produce come from?
So great question. We get 80 to 85% of our produce from Plant City. Plant City is a unique, almost like a farmer's market for farmers markets. So we go down once a week, and it is a combination of migrant farm workers, and there is some glean produce and even produce that are picked directly locally from farm workers, and we get about 80% of our produce from there. The remaining produce that we get is from we have a garden partner, Infinite Zion Farms. We have a small investment with them, and that work for garden education, and also and just growing and cycles and types of produce that we should be getting. So we work with them, and then we also, to supplement it, work with produce wholesalers to get the remaining produce that we have.
That's great. And kind of going off of what you said about, education on growing your own food and that kind of thing. Do you have any programs that really focus on, job training and educating the young people on how to grow their own food?
So another great question. So when we partnered with Infinite Zion Farms, that was a big reason why, because we know that was in our expertise, and so partnering with them and kind of letting them lead that charge. So while we don't do it directly, whether it's volunteer opportunities or wanting to learn more, and we're hoping to build and really develop more programs for people to do that. And I'm sure everyone knows where that South Street Farm is, but even getting local residents from the community to come in and learn and have access to the produce, I think, is a start of a program like that. But we need to really, put some metrics and some framework behind it to grow a program like that.
Incredible. Yeah, it takes a lot of hands and a lot of groups
It does. It does.
We know it.
Yes, you do. Yes,
awesome. We've got a comment from Kimberly Marin saying, thank you for 25 years of helping the community.
Absolutely. Thank you, Karen. Thank you so much.
And she also has another question. It says, what was your greatest challenge starting out?
Oh, wow. So, I have, like I said, been with the organization for 13 years. So I wasn't there at the beginning at year one. But what I will say, the challenge is now is, how can I be concise and say this, is because I just ran through the different programs that we do, and they range from our mobile market, which is focused on food access and food insecurity in our own little way. But again, nutrition education is the core of what we do. But that nutrition education, again, takes the place in education to adults, education to kids, and education to seniors. So, and I love that. I think that's great that we cover a range of audiences and topics and how we're able to deliver them. So there's pros and cons to that, because what other organizations are able to do is to become really laser focused, where if you think of another organization and that you are volunteering or donating to them, if you donate $5, if you give of your time, that goes towards hunger or cancer research or homelessness, you name it. And all of these are great, and in our society, in our community, they're great organizations that are out there doing this. for us, it creates a challenge because people, when they think of Hebni, it's like, well, what exactly do they do? Because it's hard to kind of boil it down to that tiny violin, where it's okay. I know if I do this, this is the benefit. So it's a blessing and a curse is what I like to say. So it's I say all that to say it's really coming out with an identity of who we are and why people would want to connect with us.
Absolutely. And it's great to have you here to kind of talk a little bit more about all the things that you are doing, because you're not just focusing on kids, you're also doing older adults and everybody. So
Right.
it's really incredible, the scope of what you've been able to accomplish. And I want to segue that into a really important question, is how can people support you? How can the community support you? How can we get involved in your organization?
Absolutely. So right now, from a volunteer perspective, our biggest days are Tuesdays and Thursdays. On Tuesdays, we are with some of our partners. Every week, we are stuffing about anywhere from 200 to 500 bags of produce. So we could always, and right at our office, we're located on a corner of Tampa and Central, near downtown, a couple blocks north of Camping World Stadium. So we're always looking for volunteers for that. Thursdays is more of a cleanup and getting organized day. Um, and any assistance with marketing and just helping to spread the word. We definitely always need that. A lot of people, for an organization that's been around for 25 years, there's just still not a lot of people that don't know we exist. We're small, we're growing, but we're small. So the more opportunities we get to connect with folks, the better it is. Of course, financially, you can always go to our website. We are a 501c3 nonprofit, so you can definitely donate there. Monies that are raised go directly to acquiring additional produce, to getting people into our classes. We don't say no to people. And I think that's one of the biggest things that I'm proud of. Just a couple of days ago, someone came in and said, "Hey, I heard that you guys have produce and I'm hungry," and we were not going to let that person walk away without produce. They didn't fall into one of our programs that we have, but that's a need. So we weren't going to let anybody go home hungry. The same is also true for our counseling sessions. Uh, our dietitians are professionals, and they have, their state licensing and are part of associations. And these are sessions that we should be charging for. And we've gone the whole insurance route. And to be honest with you, it is more work to go the reimbursement route. So we just see people. We believe that if someone needs this information, it's our duty as a community-based organization to really provide this information. We want to get them in our classes, but just today, I think our dietitians had 3 people scheduled, and these are people that came in for half-hour, 45-minute, hour-long sessions with the dietitian. And so any funds that are raised just goes to help support the mission.
Incredible. Awesome. And we can put the link to the website right there in the comments so that you can click to that directly.
Yeah.
Thank you so much for sharing that. And if you don't mind, we want to kind of go into also just commenting on the broader issue at hand. So do you know of any efforts working to change the unhealthy meals happening in schools? And what are you guys doing to kind of tackle that?
Right. So that is a behemoth of an issue. We're in Orange County, and if I remember the number, I think Orange County is the 9th largest school district in the country. So that in and of itself poses a problem from sourcing to just you name it, hiring. But we have an incredible relationship with Food Nutrition Services at Orange County Public Schools, and we've consulted with them on everything from meal planning. We have participated in a couple federal grant programs where we have worked with, on a national level, USDA Food Nutrition Services in Washington, D.C. to develop cookbooks that really introduce more fresh produce into some of the recipes. And these are recipes that we develop, tested, and standardized at our facility. And it's great to see some of those recipes trickle down to the local level. Additionally, we provide nutrition education training to food service personnel locally. So where different cafeteria workers can come and learn about the impact that they're having on kids through proper nutrition. And I know that there was a lot of rules and regulations that prohibit some of the easy things, the low-hanging fruit, if you will, because of liability reasons and just different restrictions that may be out there. They can't go out, they can't have a farm and go out and just pick, a radish and come back and cook it. It needs to all be contract traced and processed and things like that. But there are definitely opportunities, and we are glad to be a part of the conversation. And there's other efforts. There's the Four Roots Farm that is his restaurant. He's working on an incredible project. It's years out, but it's gaining a lot of traction. And in a small way, we are a part of that and looking to increase our presence there.
That's great. Yeah.
You open that package, you add some water, and 2-3 minutes later you have a hot meal. But the amount of sodium that is included in those meals for our kids, we tell them no. So we really are trying to, like you said, educate the kids on proper meal choices. Like you said, bringing food from home, but of course that brings in all other set of challenges because you're on free and reduced lunch, and finances are an issue at home. Then you'd be surprised, there's a lot of kids, don't hold me to any percentages because I don't know, but the meals that they eat at schools are in many instances the only meals that they eat throughout the day. And that just goes along with the food insecurity issue and food justice and food access issues that we deal with here in Central Florida.
Yeah, absolutely. And would you be willing to elaborate at all on the food injustices? We talk a lot about environmental injustices, but food injustice, food deserts, and food scarcity here in Central Florida is something that a lot of people don't think about. So I'd love for you to elaborate on that.
They don't think about. It's really a numbers game, and it's sad in many different instances because I love the depictions, if you will, of food deserts, and then food mirages, and then food oases. And so, on the spectrum, you have these food deserts where there's no major full service grocery stores. So what are left are these mom and pop stores to fill the need. And, they're in business, they're entrepreneurs, and their objective is to make $1. So their focus is on the bottom line. Produce is, as we all know, there can be a short shelf life for produce. So many of those small mom and pop stores don't carry produce, or if they carry produce, it's your potatoes and your carrots, things that they know can last longer, but they tend to stick to the more uh, boxed and prepared foods, because they know they can buy a case of it and it can sit on the shelf for a year or so, and don't have to worry about it. So we're faced with that. And then you go from food deserts to food on a food oasis. And that is what we like to call, you literally cross the street in a lot of these food desert neighborhoods. And it's the appearance, or an oasis, that there is plenty of food. But when you look at what that food is, it's all fast foods. So you have your fast food chains, and all congregated. And drive down any urban neighborhood, you will see, and I'm not picking on any one, so I'll say that as a disclaimer, but you'll see a McDonald's next to a Wendy's, next to a Taco Bell, so on and so forth. And so the perception on one hand is that there's food, so it's not a food desert neighborhood, when indeed it is. But because of the access to fast food and unhealthy choices, it's what we call an oasis. And then the last component to that is what we call a food mirage, where in certain neighborhoods, due to what in retail they call backfilling, a lot of grocery store operators are now going back and trying to place grocery stores in certain areas. But if you place a grocery store in a community that can't afford it, in essence, it's a mirage. So that's why we call those food mirages. So that's that story.
Wow, that's really interesting. Thank you so much for shedding some light on that. And I know that is also a monster of a situation to kind of face, but do you have any charges that you can give to our audience for something that they could speak out against, put their vote towards, anything that you can give our audience an action item, perhaps?
Right. So this is where policy, comes into play. I think efforts to grow, set aside more land for community gardens, I think is one of the first things that people can do. One of the studies that I'm a huge proponent and fan of are blue zones, areas of the world, for that matter, where people live to be 100 or greater, and they all have similar characteristics. Everywhere from I think in the US there's only one blue zone, and that's Loma Linda, California, but different regions of Europe and Asia, and gardening is a big part of that. And so from the exercise to there's so many benefits to it. So we are, I think that's one of the challenges or opportunities, is working with local landowners, and what you find, I'm sure many people listening have heard restrictions about backyard chickens, and you can't have chickens, and just you name it. So it's really kind of continuing to beat that drum, to advocate and being voices for more green space. I read a story, this is maybe 7-8 years ago, about the development of houses in the 80s and 90s compared to houses in the 60s and 70s, where houses that were built during that period had a front porch. And in the 80s and 90s, we got away from front porches. And so that stopped from creating communities, if you will. And I don't mean communities, but being able to community with your neighbors, because there was no porches. And it's incredible how a small design change like that, by having a front porch, so you're sitting on your front porch and your neighbor is sitting across the street in their front porch, and so on and so forth, and people are outside talking and walking. Those are all elements of healthy lifestyles. I'm a huge proponent of the built environment and different things to improve our community, our urban communities, through strategic land use. So that's my 2 cents on that.
Wow. That's so interesting to think about how, like you said, a simple design change could change a complete,
change a community.
Social norm.
Right. And there's studies that show that people with front porches actually walk more than people without front porches.
Yeah, because they've got space to enjoy the outside. Enjoying outside is so important for mental health. Probably
it is. There you go. And that's just part of, we in Central Florida, I know several people that work for me that have to drive to their mailbox because their, mailbox is far away. And that's just, unfortunate, the society that we're living in now. So anything to encourage in those blue zones, it's really just built into their lifestyle is what really makes them healthy. They walk to church and they walk to school, and they go gardening, and they that sense of community and laughter and being outside in nature it's all a holistic, but definitely a deliberate way of being healthier.
That's so interesting. Hopefully COVID made walkers of all of us.
Yes, definitely.
Awesome. Well, just another question on kind of some of the bigger roadblocks we had in the comments. So do you have any comments on educating healthcare professionals in, large scale on the importance of nutrition versus prescribed drugs?
Yeah.
That's obviously like people can just be like, oh, I'll just take insulin or something.
Right.
The diet change.
That's huge. And these are some fantastic questions from the audience.
Yeah, great job, audience.
I was shocked to learn maybe 7, 8, maybe almost 10 years ago, I would say, that and it's changed now, but prior to, I'm going to say 5 years ago, doctors can go through medical school and not learn nutrition because it's not, they can go through medical school and not learn nutrition. They learn medicine and they learn how to, disease management and treatment, but the upstream prevention is not something that's really taught in medical school. We've even done classes. We've had a partnership with the UCF School of Medicine, where we've had some of their residents come to our facility to participate in some community nutrition and just some core takeaways that they can use to really just become more knowledgeable about that upstream prevention, instead of meeting people downstream where your last resort is medication. So that is a huge hill to climb, because you're talking about changing fundamental changes to systems that have been in place for years, but we're seeing cracks in some of these programs. But we have, like I said, in our own small way, but I would love to see more opportunities to work with teachers to spot kids who may be at risk for childhood obesity, or maybe on that scale where they could um, um, need an intervention, if you will, to working with parents along the same way. And for the professionals, it really boils down to leadership, and leadership really wanting to make a change. So beating down the doors and being vocal to leaders of systems and decision makers that can make change. Because if you make the change, up top, the hope is that it flows downstream. And that's where we really want to, that's where we feel we are, that boots on the ground. And that's where we feel we can be most effective.
Absolutely. Thank you so much. Education is so important, and you guys are doing education and empowerment by giving people like the actual tools to do that. So that's really incredible. I think your model is what needs to happen everywhere. And that's all the questions that we have. Do you have any closing statements that you want to share with our audience?
For closing statements, first and foremost, thank you for having me. I've always loved the name Ideas, and I think that brings about discussion. I don't know if I really touched on it as well as I should, but there's still food injustices in lower income communities where they don't have a voice. So be a voice for those that are voiceless. Advocate wherever you can, and really start to form communities that can impact change. So those are my parting words.
Absolutely. Thank you so much. And everybody, please check out Hebni Nutrition, their website, support any way you can, get involved and use your voice. So thank you again so much, Glenn.
Thank you.
Awesome. I'm going to talk about a couple of our programs coming up and ways that you can get involved. First, I just want to touch on a fundraiser that we have going on right now for COVID relief in Nepal. They're doing an amazing job at being an advocate for those who have COVID. If you aren't aware, there has been a huge spike recently, really affecting children specifically. And so they set up camps outside of hospitals for people who don't necessarily need to go in the hospitals because they're being oversaturated with COVID patients, and also being a tele helpline. So people can call in who have COVID and they can give advice without having to go to the hospital. So they're doing a really amazing job over there, and they need all the help they can get. We're almost to our goal. So if you can, please support in any way that you can. And you can also support Ideas for Us just by getting involved in our organization and eco action projects. So this Saturday, we have a couple eco action projects. So Saturday afternoon, we have a fruit tree planting funded by One Tree Planted. I do want to take a moment to give a huge shout out to One Tree Planted, because they are supporting so many of our projects, and they really are implementing this boots on the ground action in partnership with us. So thank you to One Tree Planted. Please check out their website, support them in any way that you can. Also, we are working with UCF, the Creative School for Children, for this project. So thank you to them for allowing us to donate these trees, and for the work that they're doing to educate students on growing their own food. So please sign up for that if you're able to. We also have an urban wetland cleanup happening with Central Florida Recon, which is another awesome group that does a lot of cleanup. So please come out to that. It's going to be a lot of fun at a wetland that is really in need of some anti-pollution work, if you will. So please check that out if you're able to. We have an environmental justice workshop talking about affordable housing later in the month. So if you're willing, please join this conversation. It's going to be a closed Zoom meeting so that you can ask your questions and we can really have a constructive conversation. But if you're not able to make it, we will be also sharing it on YouTube later. We have another fruit tree planting happening with the Farm Workers Association later in the month as well. That's going to be great. We're going to be planting fruit trees along their community garden, while also having conversations about farm workers injustice and other food injustices happening in our community. So that's going to be a really great conversation, and also an amazing event. with light breakfast provided. So please sign up for that if you're interested. And speaking of meal prepping, we are doing a vegan dish meal prepping workshop at the end of the month. So please start thinking of different recipes that you want to share. We're going to have a couple of them like visually displayed, but also it's just going to be a time to kind of talk about different tactics when you want to meal prep. It saves so much money, so much time, and so much waste specifically. It's just all around one of the best things that you as an individual can do to increase your sustainability in your lifestyle. So that's also going to be a closed Zoom meeting that's going to be shared on YouTube later. So you'll be able to see it whether you can join or not, but we'd love to have you join and share your recipes as well. And next month, we're going to be talking about water quality with Chuck O'Neill. He's going to be giving us the lowdown on everything that's going on with water quality in our community. So please check that out. It's going to be really interesting. And then we're going to have a bunch of eco actions next month for that topic specifically. So lots going on this summer, but we have a lot more room to do more work. So if you're interested, please reach out to us. You can reach out to me specifically at kristen.anderson@ideasforus.org. We can plan an eco action project together, or I can give you information about more ways to get involved, because we really want to get the whole community involved in these eco action projects. So thank you so much for being here today, and I'll see you next time.